The night shift at St. Mary's Hospital was usually quiet. Not tonight. Clara, a seasoned nurse with 20 years of experience, could feel a tremor of unease. Maybe it was the way the wind howled outside, rattling the windows of the old building. Or perhaps it was the oppressive silence that had settled over her ward. Clara finished her rounds, checking on each patient with a practiced eye. She straightened blankets, dispensed medication, and offered words of comfort. She paused at the door of Mr. William Hawthorne, a kindly old gentleman admitted for a mild case of pneumonia. He was sleeping soundly, his chest rising and falling with each breath. Mr. Hawthorne had been admitted 2 days prior. His daughter, Emily, a nervous woman with anxious eyes, rarely left his side. Clara found Emily's constant presence unusual, even suffocating. Most family members welcomed a break from the hospital, but Emily refused to leave, not even for a moment. As Clara moved to leave, a faint, unfamiliar odor wafted from Mr. Hawthorne's direction. It was a strange chemical smell, slightly sweet and vaguely familiar. Clara frowned, her senses on high alert. Clara leaned closer to Mr. Hawthorne, trying to pinpoint the source of the odor. It seemed to be coming from his gown, a faint yellow stain blossoming on the white cotton. The smell, the stain, they triggered a distant memory, a case she had read about years ago. Panic swelled in her chest. She quickly checked Mr. Hawthorne's vitals. His pulse was slow, his breathing shallow. These were not the symptoms of pneumonia. Clara's mind raced, piecing together the clues. The cloying smell, the suspicious stain. Mr. Hawthorne's deteriorating condition. Clara's instincts screamed danger. This was no ordinary illness. Something was terribly wrong. She had to act fast. Clara grabbed the phone and dialed 911. "This is Nurse Clara Evans, St. Mary's Hospital." She spoke quickly, her voice tight with urgency. "I need an ambulance, and I think I need the police." The operator on the other end hesitated, asking for more information. Clara's voice shook as she explained her suspicions. "There's a strange smell, a stain on his gown. I think he might be poisoned." The operator, now alert, assured her help was on the way. Clara hung up the phone, her heart pounding. She knew calling the police was a serious accusation, but she couldn't ignore her instincts. She had to protect her patient, even if it meant causing a scene. Within minutes, the hospital was swarming with paramedics and police officers. Clara explained her observations, pointing out the stain and the peculiar smell. The paramedics rushed Mr. Hawthorne to the ICU while police officers secured the area, questioning staff and patients. Their investigation quickly led them to Emily. Her nervous demeanor, her constant presence, and her evasive answers raised red flags. Under questioning, Emily cracked, confessing to poisoning her father with a mixture of cleaning agents. Her motive, she claimed, was mercy. She couldn't bear to see him suffer any longer. Her confession sent shockwaves through the hospital. Clara, though horrified, felt a grim sense of vindication. Her instincts had been right. Mr. Hawthorne, thanks to Clara's quick thinking, survived the poisoning. He recovered slowly, eventually moving to a rehabilitation facility. Clara visited him often, relieved to see him regaining his strength. Emily was arrested and charged with attempted murder. Her case became a media sensation, a stark reminder of the dark side of familial love. Clara, hailed as a hero, received a commendation from the hospital board for her vigilance and quick action. The experience left an indelible mark on Clara. It reinforced the importance of trusting her instincts, of speaking up when something felt wrong. It also highlighted the complex ethical dilemmas nurses face every day. Mr. Hawthorne's case was a stark reminder that even in the sterile halls of a hospital, darkness could lurk, and sometimes it was up to a nurse's gut feeling to shine a light.